back, a naturopath from New Zealand. How are we all? Before I go further, I'll take this flippin' pillow out. It's been annoying the hell out of me. My daughter had that on this chair. She was using my office for some Zoom meetings or something. Here, Dad, you need this pillow for your butt because you're getting older now. Yeah, right. Anyway, the dangers of routine antibiotic prescribing. Let me just read you a little bit off my paper here. This paper will be made available for you guys. I think it's about 7 or 8 pages, and you can read about the different classes of antibiotics on this paper and side effects and different things like that. So let me read a bit of this. In my clinic, I used to see patients on a daily basis who were affected by antibiotics. A common scenario, for example, was that the patient was treated in the past for acne, tetracycline, trimethoprim, or trimethoprim for a UTI, basically. And they've never been well since. Candida yeast infections become a reality for too many patients after antibiotics. Some suffered with a women's yeast infection for months or even years after taking antibiotics. It is not uncommon to find a child with a behavioural problem who was treated routinely with antibiotics in the past, for example, an ear infection or a cough, a sore throat, and oftentimes they will be recurrently. They'll get, multiple subsequent rounds of antibiotics. Soon thereafter, changes begin to occur. There could be developmental delays, speech development may stop, and within a few weeks or months, the child may become unresponsive and even lose interest in things around. Okay, concerned parents take kids like that to clinics and to be told that they're actually on the autistic spectrum disorder. All right? Worried mothers may have their children in and out of clinics, and unfortunately, there are still doctors who routinely prescribe antibiotics, even for the tiniest cut or abrasion. And I can tell you, my 4 kids never received 1 round of antibiotics all the years. I used tea tree oil, Australian tea tree oil, on any cuts or wounds or things like that. The trick with an infection is to get onto it right away. Just treat it, get onto it. Natural means are very, very effective when you get onto an infection. People have been treating infections since people have been around. All right? Now, drug companies weren't around in the Cretaceous period, were they? 60, 90 million years ago. People were around then. Couldn't walk to a pharmacy then, could you? With volcanoes all around you and dinosaurs. They had nothing then. Think about it. What do? They used plants. That's what they did. All right. Now, where are we? The yeast remaining behind after treatment now thrives, as they're not susceptible to the influence of antibiotics. Some classes of antibiotics are in fact even made from yeast, like penicillin. Right? With recurring prescriptions, the bacteria left behind become increasingly resistant to antibiotics. There are many different antibiotics like gentamicin, neomycin, streptomycin, and tobramycin. A fungus called Streptomyces griseus, found to produce a substance with antibiotic property that causes bactericidal death, was discovered by a Dr. Waxman, and he named this substance streptomycin. This guy got a Nobel Prize for Medicine in 1952 for discovering streptomycin. It was in fact Waxman who coined the phrase antibiotic in 1942. Aminoglycosides are bacterial and work by stopping bacteria from making proteins by interfering with ribosomes in bacterial cells. Don't worry about that, you don't have to remember all that. This class of powerful antibiotics is used to treat various infections caused by gram-negative bacteria. Remember, these aren't the ones that don't stain with the gram test. The gram-positive stain, easier to nuke because the cell membrane is more permeable, but the gram-negative are much harder bacteria to kill. So these are serious infections. We're talking septicemia, we're talking infections after surgery, seriously bad urinary tract infections, and tuberculosis. Like, these are deep-seated infections. So they give extremely powerful drugs which wreck the gut, basically. So anyway, where were we? Yeah, that's all I wanted to say. So antibiotics are necessary, but the problem is they're also really bad. So you have to carefully make up your mind. If you're told you need an antibiotic, you may want to get a second opinion. All right. Thanks for tuning in.